To you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio. Hi, Joe. Welcome to DocTalk Radio today.
All right. It's great to be here.
It is great to be here. You know, we have a different type of a show today. I decided that we were just going to completely open the phone lines. And you know, anybody that wants to join in and chat, ask questions, you know, I'm kind of putting myself out there and just opening it up to some topics. So those of you listening, the call-in number is 480-745-1033. So let's have fun this hour. You know, if you have any questions, I would love to even hear your comments.
You know, when I talk to people about DocTalk Radio, you know, I tell them, you know, how often the phone rings and the kind of questions we get. Some are crazy, and, you know, they say, well, you know, everybody has an ailment of some kind.
That's
everybody.
Right. Exactly. Mm-hmm.
So, you know.
You know, and I think everybody nowadays is really tuned into, you know, being healthy and staying well and, you know, all that kind of stuff.
Right.
You know, and, you know, one of the things that I want to talk about is really what is wellness.
Yeah, you know, I wonder about that myself. What is wellness?
Right. You know, wellness, a lot of people think that being well means not being sick. And honestly, it really is not that way. Wellness is not just the absence of illness. It's really about being healthy of mind, physically, emotionally, spiritually. You know, and really, it's not difficult to take care of an illness. I mean, we're trained to do that in medical school. What's difficult is preserving health and wellness. You know, I have a patient, for example, that's in the hospital with a broken hip. And but yet they're healthy of mind, healthy of spirit, you know. So it really has nothing to do with the illness state. And I think that, you know, now more and more, the healthcare system, the hospitals, how the docs are being reimbursed, really is more based on preserving wellness rather than treating illness. You know, and I think people who are in the profession really understand what I'm saying when I say that, because, you know, we're measured. Nowadays, in the hospital, for example, not only on, they don't really give you, you know, a pat on the back when you do well and you treat a heart attack the right way or you know, pneumonia the right way. What we're really being measured on is patient satisfaction, you know, keeping our patients out of the hospital, keeping them well, and that sense of well-being. So that's really where things are going.
A lot of people, I know, worry about going to hospitals and doctors' offices, first of all, to pick up, I know I do, worry about picking up a secondary, and yes. I go in for a, you know, broken toe and leave with, you know, some kind of flu. Yeah,
you know, that's a great comment. And, you know, at the Gilbert ER Hospital, at Florence at Anthem, you know, our motto is door to doc in 30 minutes. There's no wait. In the emergency waiting room at our hospital, unlike a lot of other hospitals, you're not sitting there being exposed to people coughing and hacking and bleeding and all that kind of stuff.
The days of sitting there looking at the aquarium for 8 hours is gone, huh?
Well, at least in our hospital it is. I can tell you that in a lot of the other major medical centers, that's still very, very real, even in the summertime. But what you're alluding to is something that we call nosocomial infection. And a nosocomial infection is an infection that is a secondary infection that you pick up after you come into the hospital. And so,
is that common? Well,
it is common, and you know, and that's something that, you know, obviously we want to try to avoid at all costs. And the way that we avoid that is the simplest thing is to make sure that we wash our hands. You know, there's a task force in the hospital that that we're measured on. I mean, as far as hand washing. So
a task? What do you mean a task force?
In other words, we're measured on it. The nurses have educational programs. There's signage. There's, you know, constant reminders on making sure that the staff washes their hands. That's huge. I mean, that's just a huge thing.
I remember that song remember the old hepatitis song? Wash your hands after going to the bathroom.
You know, travelers' infections and travelers' health, there's something called typhoid fever. And in medical school, I remember learning about typhoid Mary, and that's simply what it is. It's a bacterial infection that food is contaminated by a human handler, and it's from that. And so, you know, we just have to be very, very cautious. You know, there was a new study out looking at kids washing their hands and school and days missed in school. So just simple things like that really lend to wellness. You know, it's not really about illness. It's really just about being well and maintaining, you know, clean hands and you know, good protocol and that kind of stuff.
You know, I have seen doctors' offices through in the past with my former business dealings that have a well side and a sick side. Boy, that's a brilliant idea.
It is a brilliant idea. It really is. There are other things in the hospital that we need to be cautious of. And, for example, blood clots. People who come into the hospital are, put in a bed, IVs are started. For example, if you come in with pneumonia or you come in, whatever, an infected leg, or you have surgery on your gallbladder, you're in bed for 24 hours, 48 hours, whatever the case. That's not good because it lends to developing decreased blood flow in the lower extremities, and you can develop a blood clot in the leg. So just simply by being in the hospital in bed, not moving and not active, not getting the blood circulating, puts people at risk for developing.
Are you talking about long term or
even short term?
Like days?
Even a day or two.
What?
And that's why, again, we have a protocol where people come into the hospital. We want to make sure that either we get them up, after surgery within a certain amount of time. Like we have a gallbladder surgery that evening. We get these people up and in bed and up out of bed, walking, moving, just to prevent blood clots from happening and developing in the lower legs.
And this is all ages?
All ages. Especially for those listeners, for those of you listening out there, this is summertime. This is travel and vacation time. And when you go on long vacations in a car, 3-hour drive, 4 or 5 hour flight, it's really vital to make sure that you remember to get up and stretch your legs and move your legs, because otherwise there's the risk of developing blood clots that potentially can go to the lung, called a pulmonary embolism.
And kill you?
Absolutely, it can be vital. It can be deadly. There's a significant percentage of people that die from blood clots every year in the lung.
Just out of the blue, and maybe they got it from a 5-hour car ride?
Exactly.
But
so,
are they predisposed to get those blood clots?
Some of them are, some of them aren't. You'd be surprised.
Just healthy people.
Healthy people. That's right. Now, some people that have an underlying malignancy tend to have, the possibility of coagulopathies, and meaning that their blood can, thicken easier and develop blood clots, quicker than a normal person that does not have a cancer, for example. But out of just in general, the normal population, it's not uncommon. And so my message is always to my patients, who are traveling, even to myself when I'm traveling on long vacations and trips, to get up and stretch and move the legs and make sure that you have, circulation. We have some people in the hospital that have IVs in. And, sometimes in IV, there's a risk of developing a, trauma to the vein and a blood clot from developing. Whenever that happens in the upper extremity, it's not as serious, for example, where that blood clot would then potentially go into the lung. It's more from the lower extremity that comes up. Now, a couple things that we recommend to prevent that is to start either an aspirin. People who are diagnosed with a blood clot, for example, are treated with anticoagulants, like Coumadin, for example. And that's very, very important to make sure that the Coumadin prevents further blood clots from propagating, from forming. And so I think that's important. So those of you listening, in times of travel, when you're in the car, when you're on long airplane rides or train rides, every hour and a half, every 2 hours, I would recommend, getting up, stretching, and moving so that you don't develop blood clots in the leg. I want to just talk a little bit about breathing and the anatomy of the nose. This is a time in Arizona where we have a lot of windstorms and dust storms. And the nose is really... there's 5 functions to the nose, and one of the most important functions of the nose is that it filters the air that comes into our lung. Should you not trim your nose hairs? Well, that's a whole other conversation. If your nose hairs are too long, then go ahead and do it. Like but getting back to the functions of the nose, there are 5 functions of the nose. Number 1, the nose humidifies the air that comes into the lung. So in the dry air, the nose actually humidifies it and prepares the air for the lung. So in Arizona, in the dry heat, the worst thing that we can do is to inhale through the mouth, because you're not getting that humidified protection, filtering of the air. And so in the dust storms, if you are caught in a dust storm, for example, try to breathe through the nose instead of through your mouth, so that you at least have that added protection, if you will, to filter the air before it gets into the lung. Wow, that's a good tip. It's a great tip, and I try to keep that in mind. If I'm out on a golf course, or if I'm out, if a helicopter, lands, and I'm in the middle of, seeing that come in, and the dust storm comes, at least try to cover your face, try to get yourself out of the way of it, But most importantly, if you do, don't breathe in through your mouth. Breathe in through the nose. At least you'll get that added filtered effect. So
gotcha. Well, Marianne's our first caller tonight today from Gold Canyon. Mm-hmm. I'm a Napa delivery driver. I get inside leg and arm pains a lot. Am I getting clots? Now I'm scared.
You know, it's one thing, Marianne, that's good is that at least you're aware of it now. You know, and it's hard to know whether or not you're getting clots or, you know, blood clots. But I can tell you that the symptoms of a blood clot are such that they're swelling. And usually you don't develop blood clots on both sides at one time. So if you notice that one leg is more swollen than the other leg, it's what we call unilateral. One side is not the same as the other side in terms of, you know, let's say your right leg is more swollen, a little painful, a little tender, particularly in the calf or behind your knee. If it turns red, those are signs that I would absolutely recommend that you get in to at least get it looked at. And the way that we look at it is to do an ultrasound. In an ultrasound, it's not a painful test. There's no needles involved in it. It takes about 15 minutes. And simply, it's just a way where we can see the blood flowing through the extremity. And if there's a blood clot there, then there's no flow. And we can actually see that.
Oh, it's blocked.
It's blocked. That's why it can potentially become a problem.
Because once it gets going, then it starts moving around?
Well, in the leg, in the lower extremity, you know, a blood clot is simply it's kind of like a blockage. It's a bunch of cells, platelets that come together and block the vein, you know, that is having, you know, blood flow through. The problem is when a blood clot forms, a piece of that blood clot can break off and then go into the circulation, go into the lung, and then if it's big enough, it can actually block the circulation to the lung, and that can be that can be lethal. So, Marianne, if my message to you and the take-home point is that, you know, stretch your legs, try to get in the habit of doing that. It's most likely what you're experiencing is more muscle tightness, you know, that kind of thing. Chances are you don't have a blood clot, but if you do see that one leg is more swollen than the other side, if you see redness, if it feels warm, and there's a test that you can do simply by taking your foot and pulling your toes back to your nose to stretch the calf. If you feel a pulling or a pain back where your calf is, then that's what we call a positive Homan sign. And that's something that I would recommend that you alert your physician so that you can get some further, you know, testing and have it looked at. Okay, so those are some of the things. You know, other things to do would be maybe consider, you know, again, through your doctor, would a baby aspirin, you know, 2 or 3 times a week be recommended for you if your job is predominantly, you know, seated in a car?
And for those of you that were calling, I had several calls all at the same time while I was on the phone with Chad from AJ. Please continue to call back. Lots of time to answer questions today. We were on the mission here to get these questions taken care of. Should people wear support stockings to avoid clots?
Absolutely. That's what we do in the hospital. Patients that come in, we put what's called TED hose on. I myself, you know, if I go on a trip, if it's over 4 or 5 hours, I have the support hose that just come up to the knee. You don't have to bring it all the way, you know, up to the hip area, and that does absolutely help with just keeping circulation in the lower extremity, and it keeps swelling down. So it's much more comfortable, and it has been proven to help to prevent, you know, blood clots. Where you can get them is from really any pharmacy. There's some sporting stores that have those support hose that are very, very good.
Why do support hose help?
Well, you know, for whatever reason, in the lower leg, the veins basically, if you think about the circulation, the heart is a pump, and the heart sits in the center of our chest, and it pumps blood out to the rest of the body. Well, there's got to be a way to get that blood back up to the heart to continue that circulation. It's a pump. And in the veins of the lower leg, there are little valves that continually, as blood flows back up toward the heart, sometimes those valves get sluggish. And when there's not a lot of movement, they just sit there. It's called stasis. Blood tends to pull, and you get swollen legs and ankles. So when you put an ACE wrap, or if you put like a support hose on your leg, what it does is it helps to compress that, and it helps the movement of the blood flowing back to the heart. And it's really very effective, and so that's really the idea. Some of you that may have been in the hospital and you had those, what we call the compression, where it's kind of like a balloon or an air compression. that does the same thing. It continually puts a little bit of pressure just to keep that rhythm and that circulation of the valves moving blood back to the heart. Does that make sense?
It does, absolutely. Mm-hmm. Chad from AJ is from back east, moved out here, and has gout. Does Chad need to be extra concerned about getting clots? And is there anything you can recommend to help with his gout out here in Arizona?
You know, as far as I know, there's no research showing that there's a direct correlation between people who have gout and a higher incidence of blood clots. What I can tell you, though, is that if gout causes you to be less inactive, in other words, if you're not as active up moving and walking because you may have gouty arthritic pain, the inactivity is what puts you at risk for blood clots. And so, you know, my suggestion to you is to, you know, get the gout treated. If it's, you know, a matter of getting on, you know, different medications, anti-inflammatories, whatever it takes to keep that under control so that you can actually be more active, that's gonna do the job. You know, Joe, when I started practice, you know, a few years, well, several years ago now, I remember that, you know, a lot of people were starting to surf the web. And for whatever reason, I had an office practice, and I started seeing more people come in with swollen legs because they were sitting on a, you know, in a chair on the computer for 10, 12, 14 hours a day. And it was new to them. And so I can't tell you how many people I diagnosed with blood clots that basically just came from them seated on, you know, on a basic chair or one of those, you know, computer chairs where you kneel and you kind of crunch, you know, kind of kneel down and your legs or your ankles are behind your butt.
Right.
That's a risk. I mean, that's a risk, just being immobile. So just be careful. You know, that's the message, is to get up. Movement is medicine.
Does it help if you're sitting a lot during your job to get one of those foot vibrators?
Well, yeah. I mean, any activity, any movement is important. You know, I wanted to design one. I had, after that time in my office, and I saw this, I thought, wouldn't it be neat to develop something that would help if you're on an airplane, just to kind of keep your feet doing this. You know, if you can just do this, you know, 20 times. Just
your foot.
Just the foot. Because what that does is, if this is my foot, it's going to increase movement in the calf, and it's going to massage.
I'm going to start doing that.
I would. You know, that's something that, without a doubt, it can't hurt you, that's for sure. But it simply just helps to kind of massage internally and get that blood flowing back to the heart. So those are some of the things to think about doing.
I have a question for you.
Mm-hmm.
I'm on a few different pills for, you know, a few different things.
Right.
Are generics a bad idea, or are they the same medications?
You know, that's a great question, Joe. You know, brand name versus generic medications. And I can tell you there are just a certain few select medications that I still kind of am a little cautious about in recommending to my patients in terms of going from a brand name to a generic.
And can I add to that?
Mm-hmm.
And I'd also like to hear your take on the Canadian and the Mexican, you know, run across the border and grab some pills.
We'll talk about that but basically just talking about the brand name and the generic. For the most part, it's the same. And, you know, for example, if you're looking at Tylenol and you go into a pharmacy and you look at the bottle, as long as the actual ingredient is the same, then it's the same. You know, the dose, you got to look at the dose. Acetaminophen is the, you know, fancy name, the chemical name for Tylenol. And if you see that acetaminophen 650 milligrams is on one bottle, and then you pick up a generic and it says the same, then you can pretty much be assured that it's the same medication. The FDA is pretty consistent in that. However, there's a couple medications that are prescription medications. For example, thyroxine. Thyroxine would be one. Anticoagulants like, you know, Coumadin and warfarin is another. Some of the anti-epileptic medicines. I'm very, very cautious in switching from a brand name to a generic, even if it says it's the same, you know, chemical and it's the same milligram, because the way that the medicine is carried into the system, it's called the bioavailability of that medicine, sometimes is different, and that's really the main thing in terms of, if you're on a medicine, let's say you've been on brand name medicines for years, and all of a sudden, you know, you get a generic, and, you know, it just doesn't feel the same, or you know, your thyroid medicine is changed, or your Coumadin is changed, and, you know, your INR starts going up and down on the Coumadin, then the first thing I would do would be to go back to what your original brand name was, because it might be that it's not as available to your body as the brand name was.
So they're not exact then, huh?
For the most part, they are.
Like active ingredient-wise.
Over the counter, active ingredient-wise, they are. But there's just a couple, select ones that I talked about that may be available to the body, the bioavailability of it, the carrier that's developed in the drug on how your body digests it. So those are just a couple things that you can talk to your doctor about. But for the most part, when I go to the store and I get ibuprofen or I get an aspirin or I get the generic. It makes sense.
When you're looking at the baby aspirin and you see, okay, that one's Kroger brand and that one's Bayer.
Same.
$6 or 99 cents.
Exactly. It's a no-brainer.
Oh, good.
I would go with the 99 cents one for the most part. Yeah. Okay. So that's a really good. Now, you talked about, getting medications from out of the country. I got to tell you, that's, we're walking on some shaky ground there. And it's mainly because I don't know, if I have a patient that says, well, I'm getting all my medicine from Mexico, well, I don't know how it's in terms of restrictions and regulations. I don't know how it's regulated. I don't know what fillers are in it. A lot of times we don't even know what the dose is.
Because they're not FDA approved, right?
Exactly. So you've got to be very, very careful. If you're on insulin, and I know the insulin that you're getting that we're prescribing from this country, I don't know really what the bioavailability is there. It's not comparing apples to apples. So that's kind of dangerous in my mind. Now a lot of people say, well, it's cheaper, and certainly it's your body to mess with, if but from a medical perspective, I would be very cautious. Yeah, I would be very cautious.
Tom from Queen Creek says, my pain pills give me a hangover and constipate me. He has chronic pain. His doc says it's normal and learn to live with it. Well, is there anything else that...
Tom, thanks for calling, because that's a good question. We see many, many, many patients with chronic fatigue, chronic pain, who are on narcotic pain medicines that cause side effects and that cause constipation. And the answer that your doc gave you, I'm sorry, is not necessarily an acceptable answer. I think that there are things that you can do. For example, whenever I prescribe a narcotic pain medication, I always kind of recommend a stool softener to go with it, because 10 out of 10 times if you're going to be on a narcotic pain medicine, it's going to slow the gut down. And so why should you suffer with that and just live with that when there are things that you can do to help with preventing constipation, for example, maybe cutting the dose or spreading out the hour of the time that you take the medicine. There definitely is side effects that cause just confusion. Some people, just don't feel, they feel fuzzy, they can't think straight. In that case, either you're on too high of a dose, or maybe it needs to be changed. So those are the things that I would recommend. There's no reason you have to live that way, because there is a lot of medications. There's a new medicine out now. It's not new, but there's new indication. There's a medication called Cymbalta that came out on the market as an antidepressant. And it was just FDA approved as a medication that has been found to be just as effective, if not more, than narcotic pain medications in treating chronic pain. And so, there's a lot of things that can be substituted, to get you off of the addictive, potentially harmful narcotic medications that are there. So I'd be careful.
That Cymbalta should make you smile at the same time, right?
That's the idea.
You never know.
That's absolutely the idea. I want to talk about smiling. Actually, it's interesting that you say that, because, smiling, it's interesting that people tend to feel better when they smile, when they laugh. There's a chemical that's released in the brain.
I know I do.
There's no question. And, there's a difference between a genuine smile and a how you doing kind of a nonchalant smile. In other words, when you go up to the window at McDonald's and you kind of smile in a nonchalant way, the brain knows that that's not an authentic smile. And so it doesn't release the chemicals that a very genuine, loving type smile does. It's
really
amazing. It's absolutely amazing. And it's interesting that a genuine smile causes the pupil to constrict. In other words, to become a little bit smaller in a genuine smile, whereas that pupil reflex doesn't occur when you just kind of nonchalantly smile. So the brain is just, wired in a way that is just really, really amazing.
Did you learn that when you went into the CIA?
Yeah, well, that's just...
Here's a real interesting one here. Sally Brown, Abilene, Texas.
Oh, cool.
Orders meds from pet catalogs. She said they're the same as people's meds and they're 10 times cheaper.
That's interesting.
That is very interesting.
Sally, that's the first time that I've heard. Most of the time I hear people giving their pets human, medications just from the drugs, from the pharmacy.
Right.
I don't know. I'm not sure how to comment on that. I would just be very cautious.
She said she gets her antibiotics from fish magazines.
Yeah, I mean, if it's the same antibiotic, then probably...
How can it be the same?
If it says, if you're getting, for example, Augmentin, and there's a medicine that is Augmentin, I would think it's the same, but I don't know.
I guess, why would they make it different, right?
Yeah, the filler is my only concern. It's, the digestive system of animals is, obviously different than in humans. So the concern would be the doses, the dosage and the bioavailability in your body. So that's the only thing that I would be cautious of that you can maybe investigate and look into is, are you actually absorbing it? And is there a potential harmful effect of the filler that it's being carried in the body? They may fill it in animals with something that might be carcinogenic to humans. I don't know. I don't know that I certainly wouldn't go there, but that's something obviously,
And I wouldn't use the dewormer.
I don't think I would either. But that's a really
Sally.
interesting question. That comes back to talking about healthy foods for animals. There are certain things that you want to avoid giving your animals. Chocolate,
right?
For example, some of the things that for those of you listening, just off the top of my head, we want to try to avoid chocolate. Grapes. Grapes are toxic to dogs for whatever reason.
What?
Yeah, you
never heard of that one.
Very, very careful. In fact, look it up. If those of you, I'm almost positive that
grapes.
The grapes. There's something in the grape. Pork you want to try to avoid in animals. Your dog mainly is
because they get worms from that, right?
They can.
And oleanders.
I mean, there's some different herbal kind of stuff that you want to try to keep your dogs from. But that's interesting. Do you have any other questions, Joe? Yet?
No.
Okay. I want to just go back to the brain for a moment because there's a lot of research coming out talking about the aging brain. Now the baby boomers are reaching the 65 years of age, and we're all kind of trying to preserve the brain and the memory. And there's a research study that came out, and basically it's entitled "Use It or Lose It." And I got to tell you that in order to really preserve memory, they're finding that the MRI picture of a brain of a 70 or an 80-year-old who is active, who does puzzles, who does Sudoku, who does reading, who does all that stuff, is literally the same as a 20 or 30-year-old. So, there are ways that we can actually not only, preserve it, but prevent the onset.
I have a comment to that.
Yeah. Mm-hmm.
I was having I started to notice I was forgetting.
Mm-hmm.
I mean, just really starting to, and I was getting worried about it. Like,
right.
Oh my God, am I getting dementia or Alzheimer's? I didn't know.
Sure.
And just coincidentally, I had ordered a couple of magazines months ago.
Mm-hmm.
I started getting them, and I was just really interested. So I started reading every night, and I put a little lamp up in my chair, and I started reading every night for about an hour to 2 hours.
Wow. Mm-hmm.
After a month, I thought back on it because it wasn't something I planned. No one told me to do that.
Right. Mm-hmm.
It really improved my forgetting.
I'm glad you said that because the study that just came out basically says that reading and even just simply walking helps with preventing, memory decline. Sitting watching TV, for example, actually increases and speeds up memory decline. So, simply reading
does it
a book.
really?
Absolutely.
Why?
It's using it. I mean, it's a matter of, engaging the neurons in the brain and really, rather than just sitting and being a spectator, you're actually participating and you're using a different part of the brain when you read and, and you comprehend and those kinds of things. So I think that's a really, really interesting. There was another study looking at computers, talking about computers and how computers are actually being found now to help preserve memory and prevent the early onset of, cognitive decline and dementia. So exercising, that's coupled with, computer use is probably the best combination. So, even though we have to sit still to use a computer, if you are exercising as well on a regular basis, the two together is just a great mind-body connection and exercise.
Do you recommend some type of eyewear for somebody who sits? Because I've noticed, I used to have perfect vision, and I've been using computers for years, and my vision has declined. Do you recommend some type of eyewear to protect yourself, or a screen?
I don't know,
something,
and I'm sure that there are. Next week, we're actually going to have a guest on the show who's a prominent ophthalmologist here in the Valley.
Nice.
And so that's something that I think we should really pose to an ophthalmologist, because I'm sure they have some insight in terms of, maybe can we prevent the early onset of age-related macular degeneration, cataracts, is there a risk of cataracts with screens? I don't know. I mean, that's a really good question. But I think it's something that we need to talk about. In that study, it said that baby boomers, for the first time in the history of humankind, will be experiencing more rapid cognitive decline than any generation before us, meaning that we're going to be seeing in the baby boomer population, which is, coming up, earlier onset of dementia and Alzheimer's, and that's not
something to look forward to.
That's not something to look forward to. So, the message out there, if you're listening, is to get up out of your chair, get away from the TV, and just engage your brain and engage your body. That's probably the best thing. And then obviously, fresh fruits and vegetables, antioxidants, are very, very beneficial. Okay. There was an interesting video that I saw just recently talking about coconut oil. And I'm still doing a little bit of research about it, but those of you listening that's interested in this would be just something to look at, because I think that there's some beneficial and some real promise in looking at coconut oil and how that helps to preserve the brain. Historically, we always thought that coconut oil was a saturated fat. And, saturated fat, for the most part, is taboo. We want to try to avoid saturated fats. But there's another piece of it, and when you look at just saturated versus unsaturated, there's the length of the chain of the saturated fat, and the long chain saturated fatty acids are not good. That's the kind of stuff that we want to try to stay away from. But the medium chain fatty acid is what is found in the coconut oil, and the medium chain fatty acid has been found to, for whatever reason, help to prevent the progression of Alzheimer's, dementia, and cognitive decline. So that's just another little tidbit of some of the stuff that's coming out in the research.
Red from Anthem says that he throws up every morning. Could it be from his coffee?
Well, first of all, when we talk about coffee, my first question is, do you use cream or milk in your coffee? Is it possible that you might have a lactose intolerance? It may not be the coffee at all. It might be what you're putting in the coffee. So that's number one. Anytime I hear a patient talk about nausea, vomiting in the morning, only in the morning, then we need to think about really pathophysiologically what's going on. And my experience has been that most people that I've seen in the office and have taken care of have what's called mesenteric adenitis. That's a fancy word simply for the sinuses drain, and for whatever reason you swallow some of the the mucus, it gets into the stomach, it causes a local reaction, and you basically get nauseated from it. And a lot of people then, vomit, and usually that happens in the morning. A lot of people end up having a lot of mucus production in the morning, coughing and, and that kind of stuff. So I would just be cautious. That would be my first thought in terms of, number one, is there something you're putting in the coffee? Try to avoid coffee and see if it goes away. If you take the coffee away and you still have the symptoms, then there's something else going on. So that's what I would suggest. But I would bet that you probably have some type of a component of mesenteric adenitis.
Is that common to be lactose intolerant and be throwing up in the mornings?
Well, no, the two don't go together. It's only lactose intolerance is really directly related to ingesting any milk products. So, if you end up drinking milk in the morning, then yes, you'll probably have more, emesis and vomiting and nausea in the morning. But most commonly, the reason I say that the mesenteric adenitis is because a lot of people have a lot of sinus drainage overnight, and you swallow it, and it causes that local reaction in the mesentery, which is in the abdomen, and then it causes you to just have a reaction of vomiting, and then the rest of the day you're fine. I had a patient that I treated exactly that. They came in and for months, morning nausea. Obviously, you want to make sure that, it's not morning sickness. If it's somebody of, childbearing age, you want to rule out pregnancy. But, and obviously, if it's in a male, you want to look elsewhere. And so we did. I simply just treated with a decongestant to dry up the drainage. Took away a lot of dairy, cheeses and milk products and that kind of stuff. And it was amazing how the morning nausea and the morning vomiting went away. So it's a pretty easy fix, from that standpoint.
Maybe we have a little group out there listening at Anthem. Another call from Anthem here.
Oh, good.
This would be Sherry. Sherry has lots of gas and uses Beano and Gas X on a daily basis and has been for years. She is starting to, or lately has had pretty bad abdominal pains. Mm-hmm. Is Beano and Gas X safe to take every day?
Well, every day, no. I mean, I think that, I would try it if, flatulence and gas. Most people have experienced gas, so that's not a bad thing. But if it persists, that's when we need to look and see, well, what is causing it? Is there a gallbladder problem? Is it something that, why do you develop the gas? Is it after you eat certain foods? Do you have lactose intolerance, for example? So the first thing is maybe diary your food, diary what you eat in the day, and kind of correlate it to, what's causing that, what's the trigger. The other thing is sometimes people who have H. pylori, and we've talked about this on the show before, it's a bacteria that harbors in the intestinal tract, and it can cause ulcers. But a lot of times you don't know it. It just kind of sits there, and it gives you the symptoms of gastroesophageal reflux, bloating, gas, those kinds of things. So that would be something that I would want to look at.
Bringing that up, is Prilosec, can you take too much of that?
Initially we thought that, well, let me just kind of give you a little outline of the different types of antacids. On the far left, there's antacids like Maalox and Mylanta and that kind of stuff, which basically just helps to balance the acid. Okay, it doesn't really do a whole lot in terms of the body producing acid or the receptors. It just kind of balances the secretions in the stomach. Next, we come to like what we call the H2 blockers. That would be Zantac, Pepcid, Tagamet, those kinds of Nexium. The H2 blocker is a medication that blocks the histamine 2 receptor in the stomach. And what that does is that acid attaches to, the gastric acid attaches to the histamine receptor. And so if you block that, then you're blocking, the amount of acid that's getting absorbed. Now we came to the newer generation of medications, which is the Prilosec, the Protonics, which actually, it doesn't block the receptor, it actually prevents the body from producing acid in the first place. So that's really the highest and the gold standard, or that kind of medicine that we have available, the best that we have. It actually prevents the body from producing acid. Historically, we thought that using it's called a proton pump inhibitor. It inhibits the pump from actually developing acid. We thought that was bad to use over a long period of time. Well, now that it's been on the market for over 10 years, we have some really good data and a lot of good research showing that, over 10 years of use of this stuff is very, very safe. And so, I don't have a problem. I can't, say that there's a problem if you need it. Absolutely, I think it's something that, that should be used. However, if it's not necessary, don't use it. Just use it on an as-needed basis. For example, if you have a big food or a big meal, you may need some help with the digestion and that kind of stuff and the symptoms. But getting back to the question, no, it is not a problem to be on that medicine over a long period of time, as far as I know, based on the research that we have. There's some other medicines that, for example, called Carafate. Carafate is a medicine that actually coats the stomach, and a lot of times I'll recommend using that along with the proton pump inhibitor or the H blocker, just to kind of help coat the stomach. The problem is that when you're coating the stomach, a lot of times if you're on other medicines, it prevents or it decreases and diminishes your ability to absorb your pills. And so a lot of times I don't recommend Carafate to people who are on other medicines that they need to take because it just prevents the absorption of the medicine, which the Prilosec or the Zantac doesn't do. Okay, so that's pretty good. I guess we're getting some calls here. I'm just going to move on. I know we have a couple other questions there. Just briefly, we were talking about the nose, and I want to get back to breathing again. Oxygen is the most potent vasodilator in the body. And so it is absolutely vital to, in the day, stop and really kind of pay attention to taking some deep breaths. What that does is it helps to expand the lung. You know, probably 75% of the adult population are what we call shallow breathers, meaning that they breathe with only the top third of the lung. And what we want to do is we want to try to expand and expand the entire lung. And the best way to do that is what's called diaphragmatic breathing. You know, the chest, if you think about the chest and you have your lungs sitting in the upper chest, well, there's a flat muscle called the diaphragm that separates the chest from everything under in the abdomen, the liver and the spleen and the gallbladder and the stomach and the intestine and everything under the diaphragm. What you want to do is, in order to expand the lung, you want to allow the belly to protrude out. By allowing the belly to protrude out, it's allowing the diaphragm to move down. So the diaphragm moves down, the belly moves out, and the bottom parts of the lung get expanded with air. And that's called diaphragmatic breathing. So, you know, just try breathing a few times in the day, bringing oxygen in. What it does is it helps to boost the immune system, and it really does help to prevent a lot of lung problems, you know, even pneumonia. You know, people that are in the hospital, we were talking about earlier, the sequelae, the effects of being in the hospital, sometimes people get pneumonia. You know, they're laying in bed, they're crunched up, you know, not breathing deeply. It's vital to take deep breaths, breathing in through the nose. Remember, the nose is a filter. It prepares the air. And then, you know, exhale out through the mouth or through the nose. Joe, do you have questions?
We do. We've got a couple lined up here. We've got Roger from Detroit, Michigan, and I can certainly relate to this one here. Has major sleeping problems, and I asked him, do you snore? And he said, I snore a lot. He said when he hit 50, which was 15 years ago, he can get hardly any sleep now. He's always tired. He takes energy drinks and Guarana?
Okay.
Guarana? Anything else, or should he live with it?
Okay. Well, first of all, Roger, I can probably bet you that you probably have sleep apnea. 1 in 7 people have sleep apnea that's undiagnosed, and what that is there's an obstructive type of a sleep apnea. There's a central type. Most of the time, we're dealing with an obstructive sleep apnea, meaning that at some point after you fall asleep, the airway kind of obstructs. For whatever reason, the back of your throat may close it off. You know, you snore, and it just kind of relaxes, and then you just stop breathing. And over, you know, after a few seconds or so, there's a certain trigger in the brain because carbon dioxide builds up. Then you wake up, and then you start breathing again, and then you go back to sleep. And, you know, that can happen 100, 200 times in a night. And because your sleep cycle is not consistent, I mean, there is no sleep cycle basically in people who have severe sleep apnea, you're basically starving your body from oxygen. It's the best way that I can put it. Your brain, you know, is starving for oxygen. And it's a vicious cycle because the more that you don't sleep, the more that, you know, time goes on, the more tired you are in the daytime. It's called daytime somnolence. The worse it is. And over time, the problem with sleep apnea that's untreated is that it can develop high blood pressure in your lungs. Now think about high blood pressure. You know, high blood pressure is a silent killer. You know, people walk around, we have, I don't know, 30 million people with uncontrolled high blood pressure, leading to strokes and leading to heart attacks and leading to kidney failure and all that stuff. But when you have high blood pressure in your lungs, it directly strains the heart. And people develop different arrhythmias. Some people even, you know, die in their sleep because they go into this, you know, fatal ventricular tachycardia that is brought on from lack of oxygen. So the worst thing that you can do is, on top of that state of lack of oxygen in the body, is to put an energy drink on top of it. Because what energy drinks do is it constricts the blood vessels. You know, so forgetting everything else, if we were just talking about energy drinks, you know, caffeine, but particularly the chemicals that are found in the Monsters and the energy drinks, that constricts blood vessels. And so now you're constricting blood vessels on top of the deficiency of oxygen in your body. Basically, you're starving your cells, and that's not good. That is out. And how that translates now, it affects every single part of your body. It affects your skin, it affects your digestion, it affects your vision. Clearly, it affects your ability to concentrate. It affects your sexual activity life. It affects every part of your body. So, it's something that I am very, very, firmly recommend, because it's an easy fix. Within 48 hours of treatment, which is simply a CPAP machine, we see people who clearly make a 360-degree reversal. Their energy is higher. They feel great. You don't know how good you can. You don't know what you don't know. You know what I mean? You don't know how bad you really feel until you start, feeling good.
It's funny you say that. My father said until he was 12 years old, he never knew he needed glasses and thought the world was blurry.
Right. I mean,
and he got them and couldn't believe it.
Right. You don't know how good you can feel. When especially with sleep apnea, even high blood pressure that's uncontrolled, it drains you, it drags you, and you just think that that's the norm, and that's not good.
Emily from Los Angeles says she's very fit, and she believes in a lot of natural things, and she believes in doing enemas. She does 7 a week for years and years to stay cleansed. Now she's having problems going on her own. She says, did she hurt herself, and what does she do? Okay,
Emily, I can tell you, obviously I would recommend that you follow with your doctor. My comment is you probably did do some harm. The body is an amazing machine. Okay, let me just tell you that we don't need to do anything to really cleanse the body. If you're exercising and we're eating right and you're staying, away from smoke and, doing that kind of stuff, the worst thing that we can do is to put a foreign object in the body. And if you think about, enemas and that kind of stuff, you're introducing pressure in a body. It's a muscle. I mean, the colon is basically simply a muscle. And so if you're constantly expanding it, it's like taking a rubber band, and if you keep pulling it, it's gonna stay stretched. And that's not good, because then it loses the elasticity. Then it loses the ability to contract and the contractile ability, so that now what you're left with is a rubber band that's expanded out that has no purpose. And on top of that, the body is made amazingly in terms of how food and nutrition is absorbed into the body. It's absorbed through the surface of the colon, of the intestine. And so by stretching it and by putting stuff inside there, you're basically destroying the integrity of the cells. And so now I would bet that you're probably malnourished. A lot of times people, with those symptoms have a lot of vitamin deficiencies, vitamin B12 and those kinds of things. So just be cautious. I would talk to your doctor about maybe getting on some supplements and really seeing where you are in terms of your deficiency. And I would stop doing what you're doing for sure. That's not good.
She said to also tell you that you're very beautiful.
Thank you. I just want to make one more comment. In terms of that, the nose sprays, same thing. The lining of the nasal cavity, if you think about it, has a purpose. Remember we said it filters oxygen and does all that kind of stuff. So if you constantly use nose sprays in your nose, you're going to do the same thing. You're going to destroy the integrity of the lining, and it's not going to function normally like it should.
We got Dave on the chat that says Glutathione is supposed to help with energy and help with my cells to heal. Is it safe to nebulize Glutathione?
I don't know. I would, I don't know. I would not nebulize anything. First of all, for the viewers listening out there, nebulize means putting it in an aerosol and inhaling it. So
kind of like vaporizing?
Yeah. And so I would be cautious because, again, the cells of the lung, I don't know if they're designed receptor-wise to receive something like glutathione. I don't know. I would not experiment with it unless I really talk to somebody, a pulmonologist or a specialist in that field. There's studies now looking at just the aerosol sprays, the tanning sprays that are out there now. The aerosol from that you inhale clearly has been shown to be toxic to the lung, even carcinogenic, leading to lung cancer. Fumes from diesel, when you inhale that stuff is toxic. I'm fearful of like hairspray and all that kind of stuff. You just have to be careful. So I would not be an advocate of nebulizing anything unless it's FDA approved and has been studied and proven.
And thank you, Dave out there. Appreciate your question. Peter G from Mesa smokes. He's down to 2 packs a day. He's tired a lot. His lungs feel tight, but can't seem to quit no matter what. Do you recommend anything to assist him in quitting?
Wow, just asking the question, Dave, my hat is off to you, because I think that, just your desire to want to stop is a first step. There's a lot of smoking cessation programs out there. A lot of times what we have found in the literature is that there are different medications, for example, Wellbutrin or Zyban. There's some medicines out there that you can align with therapy, kind of getting into some kind of even like hypnosis and those kinds of things. But 2 packs a day, down to 2 packs a day, I think there's, you've got to really think about, stopping and even cutting it down, one step at a time. I wish I had the magic pill. I wish I had the magic, message for you. But I think it's just a matter of, making up your mind and sticking with it. Some ideas that may be helpful. A lot of times people who smoke are used to the movement of bringing your hand to your mouth. And, I've heard a lot of people, I've never been a smoker, so I've never really gone through that, but a lot of people say they'll take either carrot sticks or celery sticks. And
not a chocolate bar.
And cut them, not a chocolate bar, but cut them in, the size of a cigarette, put it in a cigarette pack, put it in their pocket or their purse or wherever, and when you go to reach for a cigarette, it's that you're actually putting in your mouth, which is a carrot or a celery, and that might be something that can help with you. But good luck to you. I think that's, it's good that you're actually asking and desiring to do that.
I have a question for you. Mm-hmm. I get cramps in my hands. Mm-hmm. I know my father gets them in his calves.
Yes.
Just kind of spontaneously, and they hurt. Is there something you can recommend for that?
Yes. Cramps, a lot of times people develop cramps spontaneously. And, a couple of things that you want to think about. Number one, are you dehydrated? Being dehydrated absolutely can bring on cramps because there's a shift in the electrolytes in the body. It may not necessarily be a deficiency, but it's just the shifting of the potassium or the magnesium or the calcium, across the cell. So that's what I would look at. A lot of times deficiencies in calcium, in magnesium, in potassium, in the electrolytes tend to bring that on. There's something called quinine, and quinine has been found to be in tonic water. And a lot of times I recommend for my patients to get tonic water, not soda water, but tonic water that has quinine in it. Put a little lemon or lime, citrus in it, and drink a glass of that, at night. That tends to help maybe curb some of the night muscle cramps. It's amazing how that's been found to help that. But I just want to, while we're talking about that, talk a little bit about replacement fluids, because in the summertime, especially here in Arizona, and across the country where the humidity is high, we tend to lose a lot of fluid and we get dehydrated. The best probably fluid replacement is still water. The body, if you look at the electrolyte balance within our blood with sodium and potassium and chloride and and all that, water is the best replacement.
Okay.
Now, if you lose a lot of sweat, along with sweat we lose salt. And so, a lot of times we want to replace that and replenish the sodium and the salt. I would avoid a lot of the high sugar drinks like Gatorade and those kinds of things. Even though they say they have electrolyte replacement, they're packed with sugar, they're packed with carbohydrates, and they're packed with calories that you don't need. So maybe the smart water would be the best way to go. They have now coconut water. And we talked a little bit about coconut before for the brain. So that's what my choice and my recommendation would be for fluid replacement. Electrolyte replacement is more the smart water that really has no calories, up to 10 calories. And then that way you get it. And then for cramps, quinine, tonic water is the best.
I think we have our question of the hour.
Okay.
I wish we had a bell to ring or something, because I think this is the one. Betty Lynn from Salem, Oregon. Mm-hmm. Has been diagnosed 2 years ago with a calcium deficiency. She does not like pills, so she has chosen to chew on fish bones. She eats them until they're gone and eats several of them a day. Just recently got tested, and she still has her calcium deficiency. Do you believe the fish bones are helping, or is there something else she could do?
Betty, I have no idea. I don't know. I'm not sure what is
that could be an old Indian remedy or something.
I mean, it could be. It really could be. What I would do is I would talk to your doc, and I would just see if you still have the calcium deficiency, then you're probably not getting enough calcium. what's interesting is that Tums, if you don't like taking calcium, that's understandable. Sometimes it upsets people's stomach. But Tums is a great source of calcium. The high extra strength Tums, if you just take 3 of them a day, just chew on 3 Tums, you're going to get 1,500 milligrams of calcium, which is the recommended replacement, and then that's really all you need.
And there you don't have to swallow them or anything. You just chew those up.
You just chew them up. They come in all different, strawberry
and they're pretty good.
And mint. Yeah, they are pretty good. So I think that kind of beats. My question is, how is the fish bones affecting your teeth?
Yeah, right.
They
stick in your tongue, stuff like that.
Yeah, sometimes that can be toxic to the teeth, and you can be causing more damage to the enamel on your teeth. So I'd be careful of that. Yeah.
And I know fish in aquariums, they eat sea corals because those are calcium based. Mm-hmm. Although I don't recommend that.
Yeah, I don't know. But
Wow.
It's an interesting thought. Do you have anything else cooking?
No, we're caught up right now.
Let's talk about calcium because being that you brought it up, I think the recommendation for people listening out there that are in that perimenopausal age, either just heading into menopause or through menopause. The body tends to require more calcium when you're postmenopausal, and especially in the period of time when you're going through menopause. For women out there who are listening, you want to have at least 1,500 milligrams of calcium a day. Now, the best calcium is the calcium with D3, vitamin D, and so that's really what I recommend to my patients. There was just a study out not long ago showing that across the board for all people, regardless of what their medical history is, whether you're diabetic or not, people who take calcium with vitamin D supplements tend to live longer. Their mortality is actually improved. And so I think that's saying a lot, that that the body needs calcium.
Vitamin what?
Vitamin D.
D.
Vitamin D. Yeah, we get vitamin D from the sun exposure, but it's just important to have the vitamin D because it really helps to transport calcium into the cell, into the bone. And that's really important.
I ran into something interesting at the mall the other day. I ran into a guy that was literally orange. And I asked him, I said, nothing personal, but have you been eating a lot of carrots? Mm-hmm. He said, no, it's my spray tan. When you first get it, they're kind of orange, but it turns to nice tan after a couple of days. Yeah, is that safe?
Like I said, there's a new study that came out. Maybe you were on the phone, but the aerosol, the spray can of the spray tans, have been now found to be very toxic. It's a DHA. It's a chemical that has been found to be carcinogenic to the body. And so I would be really very, very careful of exposure. When I see somebody that comes into the hospital or to the clinic with that tint, the skin that looks yellow or orange, a couple of things you want to think of. Number one is exactly what you said. Are they eating something with beta carotene in it? Carrots and those kinds of things, sweet potatoes. Some people, just eat a whole lot of that, and it can cause your skin to turn orange. But more commonly, it's more jaundice. It's more a pathology of either the pancreas or the liver. And so, those are the things that, probably the brightest orange skin, yellow skin that I've seen have been people that have had problems with their pancreas, pancreatic cancer, liver problems, that kind of stuff. So I'd be pretty cautious about that. While we're talking about the liver, I just think about, there's some new studies looking at alcohol. And alcohol, there's no doubt about it. It is toxic to the body. A lot of people say, well, alcohol is good for the heart, and there's some studies looking at red wine and some of the wines. There's a study that just came out now saying that people who are pregnant, interestingly, can drink up to 8 ounces of alcohol in a week and be safe for the baby.
I thought you were going to say a day.
No, a week. So that's like a little bit more than one a day.
And you're talking like a shot.
Yeah, that's kind of 8 drinks, which they translate into as an ounce. But I can tell you that we see people who just come in with florid, out and out liver failure. We call encephalopathy, from alcohol. It is so bad for the body. It causes the muscle of the heart to weaken as well. So in moderation, it's fine. In moderation, I think that there's a benefit. The studies show that there is clear benefit for the heart. But in excessive amounts, it really can be a problem. There was a study just looking at people who have undergone gastric bypass surgery, bariatric surgery. On year 2, there's a higher incidence of alcohol use in those people compared to people, who have not had the bariatric surgery. So
is that due to absorption?
Probably due to absorption. That's exactly right, because it's absorbed quicker into the body. And so I think that, it probably takes less amount of alcohol to get in, and then there's an addictive, they become more dependent on it.
Wow.
And they're not maybe drinking as much, but yet we're seeing the effects of it. So that's really, you've got to be very careful of, of what we put into the body. That's interesting.
When you talk about internet studies, you can almost find a study on everything on the internet nowadays.
I'm one of the faculty members of the medical school here in Glendale, the Midwestern. I'm on the staff there as a associate faculty of the medical school. So I have, really great access to some of the new research that comes automatically, to my iPhone. So it's really, if somebody that didn't have access, that would be a huge membership fee to have access that quickly. So that's where I get a lot of stuff that we post on our Facebook pages and so forth. So it's really good, sound data that really is not accessible to the general public, and I like to share that.
Let's talk about your Facebook for a minute here, so people out there can like you and get on that subscription list. Yeah. I love it. I love your Facebook.
We started out just with a group. I had a Facebook page, and I thought, I have a big number of family members and friends back east in Pennsylvania and Pittsburgh, and I thought, I feel kind of guilty being here in Arizona and not being there to take care of my family. So I thought, well, I'm going to do something that maybe they can tune into, just some tips to try to stay healthy. And so it really started out of that, directed toward friends and family authentically. And it just kind of grew.
I know dozens of people who every day never miss your Facebook.
It's really neat. And so, if you haven't joined, come on the page. It's Joe. Do you know the address?
Facebook.com/DocTalk Radio.
Okay, it's DocTalk Radio. Come on, like us. I think we increased the number of likes, like 2,000 last week. I mean, it's just amazing.
I haven't looked at it in maybe 4 or 5 days.
We're close to 4,000.
Nice.
I find myself going. What's really neat is that there's different languages. I mean, there's many different countries that are,
that is amazing. And a lot of the countries speak, I think, English, and that's why I look at my Facebook and go, why do people in Poland?
Yeah, I mean,
you're right.
Italy and Greece and all the different places.
Yeah, that's cool.
Saudi Arabia. People from just all over the world have been to the DocTalk Radio website or Facebook page. So that's kind of neat. But we do also have DocTalkRadio.com, which is a website that we're really beefing up. From our show, we're actually over
which
time.
They're seeing right in the background.
Yeah. I can't believe we're over time, and I just didn't even notice that. But just in closing, I invite you to check out DocTalkRadio.com. And there's a lot of the resource that I talked about, and we have excerpts from our show on our DocTalk 1 YouTube station. So, Joe, we're over, and I can't believe the time went that fast. Wow.
Excellent show, and thank you so much for the questions and the comments, and a shout-out to Rick out there, who's nice there every week. Rick, great to see you out there. Thank you. And Dave, glad to see her out there, too. Dave's another one we see out there all the time.
Excellent. Good.
All right. Well, fantastic.
Okay. We'll see you guys next week.
All right.
This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.
Why is it so hot in this room, yet cold in other rooms? There's got to be a solution.
You need to call the company for your